To call to order the May 20th, 2020 meeting of the Alcohol, Drug, Addiction, and Mental Health Services Board of Tuscarawas and Carroll Counties. Just a few housekeeping items that I would like to review before we get started today. This meeting is being live streamed via the ADAMHS board website with a 20-second delay. Viewers who might be watching via the live stream have the ability to comment through the live stream, and those questions or comments would be addressed at the end of the meeting. Also, guests who might be viewing the meeting are able to sign on via the live stream if they would like to be addressed or counted as guest of the meeting. And lastly, Danielle will be taking a roll call vote for each motion that we make today to ensure that all members remain remotely connected. And with that being said, Danielle, will you please call the roll?
Sure. Melanie Bean.
Here.
Heather Campbell.
Here.
Jennifer Demuth.
Here.
Ryan Dunn.
Here.
Kelly Engelhardt.
Here.
Eric Frederickson. Brian Kress.
Here.
Mark Murphy.
Here.
Jeff Neidig.
Here.
Mary Ann Audie.
Here.
Holly Peyton Miller.
Here.
Paul Rossi.
Here.
Julie Smith.
Here.
Maureen Stoneman.
Here.
We do have a quorum.
Thank you. Board staff introductions, please.
Natalie Boland, board staff.
Michael Dotz, board staff.
Danielle Lurie, board staff.
Michelle. Muted.
You are correct. It's Michelle Sayer, board staff.
Thank you. All right. Does that conclude all the board staff on the call today?
Veronica is at a funeral, so she's not participating.
Okay. Do we have any guest introductions for today?
AJ Borowski with Community Mental Health Care. And then I have Greg Martini, Community Mental Health Care.
Okay, thank you. All right. If you will take a look at the agenda that came in your board packet. There are a few additions to the agenda for today, and I think Mike is going to share his screen so that we can see what those are. There are 2 additional items under Budget Committee. There will be a then and now request and a line item transfer. And then under item 5, Director's Report, items C and D are actually one combined item. Are there any questions or discussion about the items on the agenda? Having none, we would need a motion and a second to approve today's agenda.
All motion.
I'm sorry, who was it?
Melanie.
Thank you.
I'll second. That's Maureen.
Thank you. I couldn't
Okay.
see one.
Thank you. Will you please call for a vote, Danielle?
Sure. Melanie Bean.
Yes.
Heather Campbell.
Yes.
Jennifer Demuth.
Yes.
Ryan Dunn. Brian, can you hear me? Is he still on the call, Mike?
Yeah, he's muted. Here, I'll unmute him for you.
Fine.
Yes, yes, yes.
Thank
There
you.
we go.
Kelly.
Sorry, I couldn't unmute on screen sharing.
Oh, I got you. Okay. Well, let me unmute everybody and you'll have to be on your best behavior.
How How about we don't screen share just yet?
You can do that too.
Can we not screen share when I'm taking a vote? That would help me immensely. Kelly Engelhardt,
Yes.
Ryan Kress,
Yes.
Mark Murphy,
Yes.
Jeff Neidig,
Yes.
Mary Ann Audie,
Yes.
Holly Peyton Miller, Paul Rossi,
Yes.
Maureen Stoneman.
Yes.
Motion carried.
Thank you. Moving on, you will find the meeting minutes from our April 2020 board in your board packet, pages 2 through 9. Hopefully you've had a chance to review those minutes, and if there are any changes or corrections to those, please say so now. If there are none, we will need a motion and a second to approve those meeting minutes.
I make a motion to approve the minutes as presented.
Brian will second.
Thank you. That was Jennifer at first, correct?
Yes.
Thank you. Okay.
All right, roll call vote.
Melanie Beam,
Yes.
Heather Campbell,
Yes.
Jennifer Demuth,
Yes.
Brian Dunn,
Yes.
Kelly Engelhardt,
Yes.
Brian Kress,
Yes.
Mark Murphy,
Yes.
Jeff Neidig,
Yes.
Mary Ann Audie,
Yes.
Holly Peyton Miller,
Yes.
Yeah, we got her.
Yes.
Maureen Stoneman.
Yes.
Okay, motion carried.
Thank you. All right, we are moving on in the agenda to the Budget Committee. And if I'm correct, there was no Budget Committee meeting prior to the full board, so we will need a motion and a second to approve all the items. Jeff, would you
Okay.
like to present?
Yeah, I saw my name on the agenda, so I better. Yeah, so we're looking at the full mailed packet, pages 10 and 11, which was the list of bills through May 20th. Michelle, anything out of the ordinary other than our standard bills that we pay each month?
Actually, we adjusted the agenda to include additional items prior to the list of bills. So the,
Oh, that's right. That's right. Yeah.
So the
And
first-
do we have that document, or are you going to bring it up on the, Natalie said she was going to bring it up on screen share, right? Now and then,
you have it,
or,
I think Mike has it, yeah.
Me.
Then
I got it. It was actually not the now and then, it was the, yeah, it was a transfer. Yeah, transfer, an item transfer, and then a now. Okay, there we go.
So this is the then and now. And the reason for this is SOAR funding through the Carroll County Common Pleas Court. And this is for billing from October through March. So there was no way I could keep a purchase order open anticipating what amount of money they were going to spend through October and December. So that's why I'm asking for this. I'm sorry I didn't catch it before the packet went out. As I was coding them, I'm like, oh, shoot. So that's why we have an addition.
And the SOAR funding, if you'll recall, is that federal funding for the state opiate response grant. In Carroll County, there is a court-based navigator that works with individuals who have an opiate addiction to connect them to resources and benefits and treatment.
Okay, so we need a motion and a second then to approve this then and now certification.
So moved, Heather Campbell.
Second, Ryan Dunn.
Kelly Engelhardt will second.
Unless someone else did it.
Okay, we got Ryan as the second.
I got him.
Okay, a roll call vote.
Melanie Beam,
Yes.
Heather Campbell,
Yes.
Jennifer Demuth,
Yes.
Ryan Dunn,
Yes.
Kelly Engelhardt,
Yes.
Brian Kress,
Yes.
Mark Murphy,
Yes.
Jeff Jeff Knighty,
Yes.
Marion Audi,
Yes.
Polly Peyton Miller, Paul Rossi,
Yes.
Maureen Stone.
Yes.
Did I skip Heather Campbell? Heather, did I skip you?
No, you got me.
Sorry.
Yes, sorry. So the motion carried, correct? Thank you.
We're getting a lot of feedback from someone.
Gotta love the Zoom meetings.
You're all breaking up to me.
Polly, you may need to go closer to your router in your house again.
Oh, down to the basement. A minute. You have to join JJ in the cellar, right?
All right, so there's the next item coming up then is that line item transfer.
Excuse me. These line item transfers are basically being requested because our building expense category is a little low. We're not going to make it through the remainder of the year because we still have to pay rent and some utilities. So I'm asking for $3,239 be taken from the travel expense into the building expense.
Most of my.
The main reason for this adjustment is because we had a lot of security expenses that rolled over into fiscal year 20. We didn't anticipate almost $10,000 worth. So that kind of made us exceed our budget quickly. So putting in the 3,200, I don't think it's the full amount, but it's just in case. The second one is for the system audit. Typically, we pay for agency audits. At this point, community mental health care is the only agency that's actually locally based. Personal family counseling services is part of Ohio Guidestone, and Conquest is part of Conquest and Canton. So when we got this last payment or last bill for this, we realized we were over budget by $3,340. And when I reached out to Greg to see why the increase from the previous year, he said it's because they were lucky enough to join the single audit club. So in getting a single audit, you get more attention from the auditors because you have an excess of $750,000 in federal funds that you're spending. So it's a little more involved. So that's why the extra cost. So we're asking that be moved out from out of county crisis services because there's very little of that that's been used. I don't anticipate 9,000 of it coming in between now and June. So that's why I picked that line item.
Okay. So can we do these both in one motion then, Michelle?
Yes.
Okay, so we just need a motion and a second then to approve the budget line item transfers as Michelle explained.
So moved.
Second, Heather Campbell.
So moved. First was Mark Murphy. Sorry.
Thanks,
I
Mark.
identified myself.
Okay.
Roll call vote.
Melanie Beam,
Yes.
Heather Campbell,
Yes.
Jennifer Demuth,
Yes.
Ryan Dunn,
Yes.
Kelly Engelhardt,
Yes.
Brian Kress,
Yes.
Mark Murphy,
Yes.
Jeff Knighty,
Yes.
Marion Audi,
Yes.
Polly Peyton Miller, Paul Rossi,
Yes.
Maureen Stoneman.
Yes.
Motion carried.
Thank you.
Mike, there you go.
Okay.
All right,
Jeff?
we ready for the next one?
Mhm.
Okay, now we're on the list of bills, right? Number 3, review and approval expenditures. Okay, so now on pages 10 and 11 are the list of bills totaling $273,626.24, unless that's been modified since, but I think that's as it was. Any out of the ordinary expenses there, Michelle?
The very first expense under publications for Gongwar News Service. That's a news service that we've subscribed to for years. It basically just sends updates to Natalie of what's happening in the, in the country, and it's a lot of good information. I know she does pass some of it on sometimes too. I'm not saying that she's stingy, but I know she shares it. She shares it with others.
It's
So
a lot of legislative information, governmental information, and it's very heavy on what's happening at our state level.
So that's an annual expense. So you will only see that once a year. Halfway down, community education, we have Barnes Advertising, and that's just for some billboards for crisis text and mental health month. And right below that is Blooms. We had some beautiful annual reports printed, and they're sitting on the table at the office, but they look beautiful. So I'm sure that we'll get them to you at some point. And as I mentioned with the then and now, down toward the bottom, you'll see 731 SOAR, Carroll County Common Pleas. That was October through March. Under community housing, AEP expenses are up a little bit. I think a lot of people are struggling to pay their electric bills. So we had a banner month with AEP. And the very last thing is multi-system youth funding for council, Family Children First Council. That's passed through, and it's $22,500, and it's at the very end. And that is a wrap.
Okay, any questions for Michelle or any other concerns on the list of bills through May 20th? So hearing none, we'll take a motion and a second then to approve the list of bills in the amount of $273,626.24.
So moved, Heather Campbell.
Second, Brian.
Thank you.
Roll call vote.
Melanie Beam,
Yes.
Heather Campbell,
Yes.
Jennifer Demuth,
Yes.
Brian Dunn,
Yes.
Kelly Engelhardt,
Yes.
Brian Kerr,
Yes.
Mark Murphy,
Yes.
Jeff Neidig,
Yes.
Marianne Audie,
Yes.
Holly Peyton Miller, Paul Rossi,
Yes.
Maureen Stoneman.
Yes.
Motion carried.
Okay, let's move on to review and approval of statements through April 30th, 12 through 15. In your packet, again, we are getting close to the end of the year, so most things should be spent down or getting close to, or we'll carry them over. Anything, obviously the board expenses are going to be different because of different travel not happening and things like that, but anything else that we need to pay attention to, Michelle, any concerns? I mean, obviously you take care of them well in advance, but anything else looking like we might have to adjust?
At this point, I don't see anything. The agencies can be behind in their billing. I don't know for certain. But we're just doing the best that we can and going day by day.
Okay. Anybody have any questions specific to the detail revenue expense or the balance sheet was presented? Any concerns on any of the details and percentages?
I do want to say that a lot of the 75% that are under the state revenue, we have received the balance in May. So
Okay.
those funds are already here. A couple of the ones that are lower than 75%, such as mental health, ECMH expansion, that's a that's a drawdown. We draw down based on what the agency bills. Same with SOAR. When you go down to the end, right above levy, state opiate response. That one, we've drawn down about 32,000 since this was posted in April. So we've got a nice chunk there, and there's still going to be more because we have through June. So we're not in bad shape.
Okay, good. All right, if there's any other questions for Michelle? If not, we will entertain a motion to approve the financial statements ending April 30th, 2020.
I'll make that motion.
I'll second.
Okay, roll call vote.
Melanie Beam,
Yes.
Heather Campbell,
Yes.
Jennifer Demuth,
Yes.
Ryan Dunn,
Yes.
Kelly Engelhardt,
Yes.
Brian Kress,
Yes.
Mark Murphy,
Yes.
Jeff Neidig,
Yes.
Marianne Audie,
Yes.
Holly Peyton Miller, Paul Rossi,
Yes.
Maureen Stoneman.
Yes.
Motion carried.
All right, so the next probably is going to be handled by Natalie. That would be the CMH budget adjustment request, and everybody has some details on the timeline and such. Natalie submitted that in the packet, pages 16. So Natalie, you want to take care of that? Any actions and review of that?
Mike, can you put us back to full screen? Thank you. So we have been communicating as a board for a couple months now about the Cleveland Clinic initiating crisis intervention assessments in their ED. As we had talked about, this is not something that was requested. This is a line of business that they decided to pursue, and it's had a significant impact on our local system of care because CMH is not able to get Medicaid revenue or benefit or insurance revenue from those that they typically had they've gotten revenue from to support that service. We had talked a lot about it, and I had said this to JJ, and we had said this on our last meeting, the concerns about using taxpayer dollars to fund revenue loss. And at that point, we had decided not to provide a subsidy. JJ had a board meeting at the end of April, and the CMH board came back to us with a request to consider two things: to consider a subsidy of $31,194 from the end of April through June 30th. As well as an increased reimbursement rate. And from what I had shared, what the Medicaid rate is and what our current reimbursement rate is. So we have a couple of things to discuss. One is the board's position on the subsidy and the increased Medicaid rate. And from my recommendation, where I am with the Medicaid rate is I'm uncomfortable with continuing to increase above the Medicaid rate. My recommendation for discussion, and I'm sure JJ and Greg will speak to this as well, but is that we look at covering the cost through June. So there would be discussion between Michelle and Greg and JJ about what is the loss, what can we cover from within their existing contracted amount, not an additional amount, through June 30th. So it's going to be not a flat sum of 31,000, but enough to cover what some of their losses are up to that amount. I know that there were a lot of questions that the board members had, a lot of thought that the board members have. So I'm going to quiet down and let you speak and let JJ provide a picture. JJ, do you want to start?
Sorry, what was that?
JJ, do you want to start with anything you'd like to add?
No, I would just, I had the discussions with Natalie, and it was communicated that losses would not be covered through funding from the ADAMHS board. So what we submitted to you for consideration is our cost. This would be our cost to deliver the service the last 9 weeks of the fiscal year. And so what you have is an adjustment of our crisis intervention budget, which took into account the significant reductions in the amount of units that we would produce. We also decreased some of the cost, not a huge amount, but because we wouldn't be paying staff to go out as much on call, we wouldn't be reimbursing as much in travel, excuse me. So that decreased some of the cost, but the big thing is the reduction of units, which would not produce the revenue to cover our costs during the last 9 weeks to keep this service going.
So I know that the board members had some questions that they wanted to talk to CMH about. So Mike, can you unmute, and anyone that wants to ask some questions, please feel free.
JJ, what's the primary breakdown of these costs that you're trying to cover? Can you give us a little more information?
Yeah, it's the cost of the service. So it involves salaries, fringes, your overhead costs, supervision, things like utilities, the insurance, the IT costs, everything associated with the 24-hour coverage.
Okay. I guess my question is for you, JJ. Moving forward past June, is CMH interested? Are you guys wanting to continue providing this service? I know there's been a lot of change in the industry with a new player come to town. Some of our best practices and the way we do things have shifted a little bit. Is CMH interested in continuing to provide the crisis assessment service?
Yeah, absolutely. And that's why we're submitting this budget revision to continue covering our costs and delivering the services. One of the challenges is, yes, we want to continue doing it, but the question is, can we continue to deliver a quality service? In looking at this in our discussions with Natalie, we've looked for ways to do this service differently to come in at a much lower cost. But for some of you that were around back in, gosh, what was it now? 2011, when the recession hit, we had a significant budget reduction. I think it was in the amount of $1.2 million. And that's when we went from a 24/7 crisis service to what we have now as far as our on-call system and 2 staff during the business hours. So when you're talking about reductions, if we're reducing our costs, there's not much that we can reduce in terms of staffing, because you have 2 individuals during business hours and 1 on call after hours. So I'm not sure where you would reduce staff. On the other side, if you talk about reassigning job responsibilities so they can produce more revenue to cover costs, well, then now you're creating a system that's less responsive. So if we have counselors that are schedule-based, doing diagnostic assessments, doing individual counseling, doing other things to cover costs, and then you have 2 or 3 crisis situations that occur, do we cancel the clients and say, sorry, we're going to go respond to a crisis? Or do we tell the crisis situation, you know what, hold off for 2 hours because we need to take care of these individuals first? So any reductions you do, whether it be in staffing or reassignment of other things to generate revenue, you're creating a system that's inefficient, not responsive to the needs of the community. And that's the decision where we're at. Do we continue doing what's left, so to speak, and serving jails, serving other community entities Or do we say this isn't something we can do because we can't do it well?
Well, that would be a shame, because I was pre-2011. I remember where our system of care used to be in our communities. And I agree with you, JJ, it's been scaled back and scaled back and scaled back. And ultimately, the people that suffer are the people that are needing the services. I'm really concerned with, as the rest of the board members, as I've tried to portray or share, I work within the system. I work with your staff all the time, JJ. I think your services are a tremendous asset to our community. Crisis services, when you were a 24-hour operation, was fantastic. When you guys used to come out to the scene was fantastic. With that said, what it's been scaled back to, it works. The jail-based system, last thing we want to do is lose a crisis assessments in the jail. The last one I know that happened here in New Philly, we had to do it through the jail door. The only way we got them out of our jail successfully and safely was through use of chemical restraints. Otherwise, somebody was going to get hurt. So if we lose that, now we're having to transport people to the hospital prior to being able to be assessed. And now we're having to deal with injuries before the assessment. And that always poses a new set of circumstances and challenges for the assessment. So, you know, looking at what the budget request is to cover you through June, if I did my math right, it looks like it's $9,310 less than was actually budgeted for the fiscal year of 2020.
I thought it was like 6,900. Yeah, I thought it was 6,900 in total expenses that were reduced. That may be the net of it. I don't have that in front of me.
I think the, if I'm reading all of my papers right, it was $71,322 that was budgeted for 2020. We, you got a thing, the increase is 31. I may be reading my notes wrong, but I think with the, looks like the total $62,012.
So Paul, I just want to jump in here. Where I want to make sure we're comparing apples to apples. There was a request initially submitted in at the start of FY20 for a subsidy. In August, the Ohio Department of Medicaid increased their crisis reimbursement rate. So they bumped it up to $145. At that point, CMH came back to us and said, you know what, with this increased rate, we don't need that high of a subsidy amount anymore. So at that point, their crisis subsidy was reduced to around $30,000. So that $30,000 plus their request of $31,194 for the last 2 months of the fiscal year is what brings us to $62,12.
Thank you, Natalie.
Yes.
So I have a question about the current utilization. JJ, you have those two staff on call during the day, during business hours. What is the current kind of percentage utilization of those staff for crisis calls? What's that need?
Crisis calls, you know, I don't have the current crisis call volume in front of me. I mean, I have assessments, not calls.
Okay. I guess what I'm wondering is, I hear that we have those two staff who are available for providing emergency services during business hours, and that one person on call outside of business hours. I understand that. What I'm looking for is some kind of understanding about, of those 80 to 90 man hours per week for during business hours, how many of those are actually used?
You don't
Those are salary positions that we're talking about.
But he's asking how much how many assessments.
Do they
Per
do?
hours.
Yeah, I don't have that in front of me. I could get that, but I don't have that.
Yeah.
Well, the other piece of that would be, are those same staff manning the hotline during business, during office hours? Do those staff man the hotline? And if they do, how many hours of their time is spent handling those crisis hotline calls that come in? Because that is part of the service that we are contracting with also, and that's an important service for our community.
Yeah. Again, I can run those numbers and generate some reports. I'm sorry, I don't have those in front of me today.
But they do man the hotline during the hours that they're here, and after hours, CSU staff man the hotline.
This is Kelly Engelhardt. I would like to know, JJ, if you know from your data, how many of the assessments are provided to Carroll County residents?
Yeah, again, that's something I can generate. I didn't generate these numbers for today, but certainly I can get those.
So just so I understand the system, when you have the need, your staff then come over to Carroll County to provide those, correct?
Yes.
Okay. Are they doing that in the jail as well?
Yes.
Okay. Thank you.
JJ, this is Brian Kress. Yeah, I'm kind of viewing this a little bit almost like a catch-22 to some degree. I mean, I would echo Paul's prior thoughts on this whole situation, but I see it as two different, I kind of break it down into two different areas of a short-term need and getting through this year and what needs to be done to make things whole as best can be done, and also as a long-term situation, and in conjunction with what Cleveland Clinic Union is going to do in the future. I don't know, JJ, have you or your staff had any conversation with Union about their intentions on moving forward? Do they plan on still doing this as a full-time service on their end? And then if that's the case, even if it's just the assumption that that's the situation, where does that leave CMH long-term with this? And is that just going to be a major decrease in flow to you in the organization, to CMH organization? And what does that do to the big picture long-term?
Yeah. So with the context that I have at Cleveland Clinic, a lot is unknown because everything is coming from top down, from Cleveland down, as they roll things out and progress down that path of integration. So a lot of people don't know. Even when this started back in December, it was kind of rolled out in phases, but people didn't know what was going on. Do we, see insurance-only patients? Do we see Medicaid? What about the folks without insurance? So there was a lot of uncertainty even at that point. Long-term, that's a good question. And that's kind of where we're stuck in all this. And unfortunately, all this is happening during a pandemic where, it's difficult to pull people together and say, okay, as a community, what do we want in a crisis system? What do we need?
JJ, this is Julie Smith, and in kind of tagging on to Brian's question, as far as the long-term impact of this, do you find there has been a change in since you're not doing the crisis assessment and those folks then are hospitalized in whatever private setting? Are they being referred back to you upon discharge for their follow-up outpatient treatment, or are you seeing a decrease in that as well?
Again, that's hard to say. If they're doing the assessments, we're not involved, so we don't know. So we don't know the total number of assessments versus who's being referred where. That would be a question for them.
Do you see any decrease in your volume of outpatient referrals since this was implemented?
Again, yeah, the pandemic, you have a number of different factors here. But yes, during the month of April, we had about 60 less assessments and new patients than the average.
Yeah, that would be the layer of pandemic over that. I'm sure though, it would probably is skewing that.
Yeah.
So what's the viability of being able to continue to provide this service long term? What I understand the general picture is, with the declining number of assessments, of course, the per assessment cost goes up because you're saying, hey, we have some fixed costs here with salary, et cetera. And so is that the reason for the substantial percentage increase that you're requesting for the coming year?
Yeah. Yeah, and obviously the long-term viability, a big question mark is what the board wants to see happen. What are you willing to fund and what are you willing to put dollars into? If you ultimately decide that this isn't something you want to invest in as a board, then we're going to have to make some business decisions as far as, can we support this service or not?
And this is Heather. And I think, if I'm not mistaken, there aren't any other alternatives in the Carroll County market that are, but perhaps I'm overlooking something. So if someone could speak to the need for this, thinking about the 2-county kind of area. And in Carroll County, there's just a lot less resources. In Union Hospital, Cleveland Clinic would still be a good 45 minutes, maybe even more than an hour, depending on what region of the county, for accessibility to people there.
So Heather, the way that would look right now is CMH assesses individuals when they come to their facility, correct, JJ? You're doing Carroll County Jail, but not necessarily any other location in Carroll County, right?
Correct.
And I believe that many of our Carroll residents are going north to a hospital or south to CMH. If CMH would discontinue crisis next year because of all of these issues, Cleveland Clinic, if we would work with them, will have to serve both communities. We will not leave Carroll without a crisis continuum.
And you guys, my fear is this is all by design. My understanding, Cleveland Clinic does this from Cleveland all the way down to Cambridge. They come in, they push out local services, they set up their services. I'm hearing rumors that they're even talking about buying Altman Hospital. JJ, I'm all for getting you through the end of the year. I don't want to lose our crisis services. For the board members that aren't really familiar, the reason why the CMH is losing the assessments is by design. When they had the redesign of our system because of money back in 2011, it became common practice that if somebody needs assessed, they needed to be done in the hospital setting to rule out any sort of physical ailments that could be caused in the psychiatric situation. That was safer because CMH isn't open 24 hours a day after 2011. So by design, all the client base was at the hospital because Union Hospital had no desire to involve their social services. Well, now CMH or Cleveland Clinic came in, they have all these resources. So by design, our system of care already set up to send them all of our assessments. So therefore, catch-22 is it's cut CMH out of the picture. And as a community and as that community-based board, I'd hate to see a local organization get pushed out of the system. We've already lost one agency since I've been on the board. I'd hate to see, I guess, but however, moving forward past June, I mean, these are huge increases that we're seeing. I think my fellow board members would love to hear if there's any innovative ways that you're talking about, maybe getting some of those customers back? Are you looking at sending your full-time staff out into the field more frequently? If police are on scene and we need to do an assessment, instead of calling for a squad or transporting them to Cleveland, can we call a crisis and have one of your workers meet at the scene and kind of cut that pie a little bit?
Yeah, it's a perfect lead into exactly what I was going to say. During our discussions about how do we, what is a good model, or how do we redefine the service so that it both meets both the clinical needs of the community and also, the financial needs. And that's one of the things that we talked about, was returning to doing more on-site assessments. And we've even talked about how do we, shift that kind of crisis system thinking so that maybe set up CMH for that first contact to get those billable services. So yeah, we've talked about that. And that was one of the reasons that, we built the budget as it was, with some of the increased costs as we could anticipate them now. Not knowing how the community would receive that and how many additional assessments and how much revenue, excuse me, that we would gain by going back to that. So yeah, that has been discussed internally.
Yeah, if we were able to look at the number of the or somehow know the referral source of the clients that are being assessed at Union, you would be able to gain a greater picture of what percentage come from law enforcement, and we could kind of circumvent that and only be sending them to the hospital to get the medical screening if hospitalization is required. And at that point, we would already have, or you would have already provided the assessment for them. And so it's only a matter of placement.
This is Jeff Neidig. Just a few questions. A lot of them have already been kind of talked about, but you just talked about, JJ, some of the things you're looking into. Are you, I'm sure as in all industries, there's support groups or associations and forums that you can put questions out to. Have you reached outside of this area, maybe into an area like Paul said that's already been impacted by Cleveland Clinic and had a similar practice like yours, and said, what have you done to survive, and have you survived, and looked at their practices to continue this whole crisis, as Natalie calls it, continuum of care, from start to end, with assessments to follow-ups? Have you looked at best practices that are out there?
Yeah, and honestly, it's all over the place. And every county's different, especially because of decisions made at the local level like this, as far as what boards will fund and what they won't fund. So yeah, there's, all kinds of different arrangements.
Okay.
Again,
Anything that you're thinking of?
A lot has to do with whether your local hospital has a psychiatric inpatient unit or not. So for example, like in Jefferson County, they have a psychiatric inpatient unit. So the hospital, kind of like Cleveland Clinic, does all the screenings, does the admission, but then at the agency level, all they're responsible for doing is the assessments for the state hospital. Some counties have nothing, that it's just an answering service that refers people out, takes information, passes it on to agencies the next business day. Then you have 24, so you have everything in between, as far as you have a 24/7 crisis center versus just an answering service.
Answering service. What about, have you or the board looked at, what are all the services in that spectrum that Cleveland Clinic routinely does? Are they going to assess these people in the ER and then refer to their own people outpatient? Is that what they do? Which certainly looks into the future of capability, what CMH can do. Or do they have a tendency to refer to local providers, since potentially could be more convenient for the patient, or the telemedicine or whatever? What are you seeing from a standpoint of what services they offer when they come into a community like this versus what you all have been doing?
Yeah, I've not done any investigation to see what outpatient services they're offering.
Okay.
And Jeff, I can speak to Cleveland Clinic. Well, Union before Cleveland Clinic has a behavioral health center that they opened, and it's kind of on that same campus. They only provide intensive outpatient. They don't provide individual services. So my understanding is that once an individual is done with that intensive level of outpatient, they refer them to the community outpatient providers because they don't provide that after that series is done.
Okay. But would you still consider that in as a part of crisis services, or are they out of crisis services at that point?
That's really office-based services. That's more of a clinical intervention than a crisis intervention.
Okay. So basically, crisis is being all handled by CM or Cleveland Clinic Union Hospital from beginning to end of the crisis, and then they refer them out to local agencies. Is that right?
Unless
Well,
we have them come to the scene. If CMH is involved during the crisis, they refer them to individual hospitals and follow that person around. If the person goes to the ER first, or if the squad or law enforcement or family member takes them to the ER first, CMH is never contacted. It is, if they will do the assessment, they will do the placement within their network.
It's
Well,
almost like Paul was saying, you almost need a team, kind of like we had with the overdoses. You know, you almost need a team before all that happens with crisis to go out, or, you know, is there EMS training or EMS availability to do that kind of stuff? Or it's certainly out of my realm of healthcare thinking, but is there a team approach that could be developed, you know, whether it be our own initiative or something somebody else has done? I know it'd be difficult with our geography, but you know, just again, you know, looking at CMH longevity with this service, you know, what have they looked at, you know, on that whole spectrum? Because if more and more people are just relying on the ambulance to take them in, obviously that hurts. So you got to like Paul said, the piece of the pie, you have to intercept that with some other mechanism to conserve those patients.
This is Kelly. I think that it's not our job as the board to, even though we were trying to understand the system and how it works, to redesign the system. I think that's the provider's role in coming to us as a board with how can the system work better for our communities. But I think one of our roles really here is to understand how long can we sustain 2 providers for crisis assessment services in both of our communities, because both are being funded, and you know, at some point we're going to have to think about the sustainability of both of them. And you know, Paul, I totally agree with you in that what we've seen in regards to local providers being cut out of the mix. But unfortunately, I think that's where our healthcare system is going right now, is that the big entities, the Cleveland Clinics, the university hospitals are gobbling up everything that they can in order to increase their revenue. But also they have the support for when there is an issue where there's losses or there's a pandemic, that they can float it. And you know, at what point is it our responsibility as the ADAMHS board to continue to provide funding for 2 service providers? And where is that breaking point, I guess? And how do we figure that out?
We aren't funding Cleveland Clinic. They're a private organization, right? Am I correct in that? We're not sending money to Cleveland Clinic, right?
Correct. We are not funding Cleveland Clinic.
And essentially, with the decrease in services at CMH, partially what we're funding with this subsidy, and the way I look at it is we are funding the availability of the service for our community we are funding the availability of a very unpredictable need, because nobody can predict, you know, when a crisis is going to happen or how many people are going to have a crisis and need that service.
This is Polly. I've finally gotten into the meeting. I just have a few things to say. I have had to use the crisis line when I was ill, and I got very compassionate and caring response and treatment. And I am very concerned that if we change to the hospital, that our consumers will not get the same kind of care that I got. And so I don't think it's a money issue. I think it's a quality issue. That's all.
Thank you, Polly. Well, it seems like there are, you know, we are looking at a short-term and a long-term issue, and I don't know that we can solve the long-term questions today, but what we do have before us is the request for the budget adjustment for CMH. And so we do need to make a decision today, or we're being asked to make a decision today if we feel we can do that, regarding the request for the increased subsidy, as well as addressing the request for the increased non-Medicaid rate. Is there a consensus that we feel we have the information to move forward with making decisions about that short-term request over the next 9 weeks?
That's bumping it up to $31,194.
That's an additional subsidy of $31,194 is one issue. And then the second issue, I see these as separate, would be whether or not a decision is made to increase the non-Medicaid rate.
So
Am I summarizing that well, Natalie?
That's correct.
And I just want to make sure I'm clear. When we're talking about increasing that non-Medicaid rate, we're looking at what we're currently paying is $160 to $350 an hour for the first hour. We aren't even really sure from there where it would go.
Melanie, that is the FY21 budget request.
Okay. Sorry. I just want to make sure I'm understanding, but that's for next year. That's the subsidy. Okay.
Someone's playing music in the background. Could you mute your phone?
Sounds like an organ.
Natalie, can you summarize your recommendation one more time for us?
Correct. My recommendation is that as CMH, Mike, can you mute that, please? My recommendation is that we, within their current contract, look at the $31,194 based on what their need is, what their cost and their reimbursement is, and Michelle and Greg will work together to do that throughout the end of the fiscal year, the next few months. The maximum amount of the subsidy that we would pay would be the $31,194. And I do not recommend another increase in the Medicaid reimbursement rate. When I looked at what their average billings are, it's not going to make that much of a difference to not increase the rate $10. And it does concern me when we continue to move services above what the Medicaid ceiling is. So I do recommend the $31,194 within their contract based on cost, not a lump sum. I do not recommend the increased Medicaid rate.
All right.
So this is Jeff. I'll make a motion that we approve the subsidy amount to CMH in the amount of $31,194 for the remainder of the year for their actual costs of service.
Second, man.
Do we need to clarify that that's up to $31,194?
Please.
Could you restate that, Jeff? So I'll move that we approve 31,001 up to, I'm sorry, start that over. I have moved that we approve up to $31,194 to CMH for subsidy funds for the remainder of this fiscal year contract for their covering their actual costs.
Jeff, can I add that that's funding within their current contract, not additional?
Yes, within the existing CMH fiscal year 20-year contract. Fiscal year contract.
Danielle, do you think, did you write all that down?
I got
Would you be willing to restate what you wrote down so we're clear on what we're voting on?
question. I made notes. I really didn't write it. The motion on the table states the board is recommending up to $31,194 additional subsidy for CMH crisis based on the actual cost for the remainder of the fiscal year from funding that has already been allocated to the agency.
Within their current contract.
Within their current contract, yep.
What's the distinction, I guess, up to? I'm seeing the subsidy available will not exceed $31,194. What? And this is a subsidy, so we've already been subsidizing, correct?
Correct. Paul, what is your question?
He's frozen.
I'm confused. I'm reading. Never mind.
Are you sure?
Yeah. I think I figured it out.
Okay, Jeff made a motion, which Danielle just reread to us. We would need somebody to make a second to that motion, and then we could vote on that item.
I'll make a second.
Thank you, Polly. Okay, roll call vote.
Melanie Beam,
Yes.
Heather Campbell,
Yes.
Ryan Dunn,
Yes.
Jennifer Demus,
Yes.
Kelly Engelhardt,
Yes.
Brian Kress,
Yes.
Mark Murphy,
Yes.
Jeff Neidig,
Yes.
Marion Audie,
Yes.
Polly, Peyton Miller,
Yes.
Paul Rossi,
Yes.
Maureen Stoneman.
Yes.
Okay, motion carried.
Thank you. Thank you, JJ, for coming today to answer our questions. I think there are some additional questions and probably some additional work that or action will need the board staff to follow up on regarding the request for the fiscal year 21 budget.
Well, do we need an additional motion for the rate increase?
So if the board is moving for an additional rate increase, then someone would need to make that motion.
I guess my question is, you said it was right around $10 rate increase. What's the objection to that?
You know, most of the other providers in the system provide services at the Medicaid ceiling and not above. I think whenever you are flexible with the Medicaid rate, that puts you in a difficult position. We're providing a subsidy and an increased rate, which I think could be duplicative. That is why.
This is Jeff. I'd like to move that we table the discussion on the, where's the terminology here?
Rate increase.
The rate increases for crisis assessments of indigents. I'd like to table that.
Well, we're not talking about 300 rate increase. We're just talking about the rate increase to June.
Right, from 162 to 174.26 initially, then there's the other recommendation, yeah, exactly, of that next year's budget, they're requesting up to 350. That would be a budget discussion for next year. But from now to the end of the fiscal year, going from 162 to 174, was it 174, all these numbers, it's 174.26. I'm just making a motion, we table that discussion.
I second.
Sorry, Ryan.
That's all right. Hey.
Okay, a roll call vote on tabling the increase.
Melanie Beam,
Yes.
Heather Campbell,
Yes.
Jennifer Demuth,
Yes.
Ryan Dunn,
Yes.
Kelly Engelhardt. Kelly?
He's off.
No. Brian Kress,
Yes.
Mark Murphy,
Yes.
Jeff Knighty,
Yes.
Marianne Audie,
Yes.
Holly Peyton Miller,
Yes.
Paul Rossi,
No, I think by the time our next board meeting comes around, it's gonna be null and void.
Maureen Stoneman.
Yes.
Motion carried.
Is there anything else you need us for? Any items of business?
Well, can I make a request? I know, JJ, I heard several board members ask some questions about level of services, referral rates, and ask maybe for some more details from you. Because I work in school, I know that I refer a lot of kids to you guys in the months of April and May. So when you do those breakdowns of your referrals, could you, those numbers, could you talk about like differences in school age and adult populations, and then also break it down by county for us?
So are you asking just for crisis services, or you want all referrals?
I'm primarily crisis services, but I think that at some point in time, unless I missed something, I was really trying to pay very close attention. It felt like there were some concerns that not only were you losing crisis services, but some referral services as well because of the Cleveland Clinic unit. So I guess I would kind of like to see those numbers broken down a little bit better. And also probably would like to think about what your plan might be if that rate's different next year. So
yeah, so I'll certainly get all the referral information. I'll share that with Natalie, and then you can disseminate that to the board. So I heard the two requests as far as referral information for crisis, the different breakdowns, and then also Dr. Dunn was asking about the hotline calls during the day and the volume and that. Was there anything else that?
Yeah, I think I'd like to see a comparative to prior to, the Cleveland Clinic providing some of these services to the current, just so we kind of have a historical perspective in terms of perhaps the decrease that we've seen thus far to maybe help predict future potential decreases as well. So.
I was looking at April numbers and they're not good.
It's so difficult in this climate to predict any kind of regularity or normalcy at this time too. So we sympathize with you in terms of that, and perhaps providing a larger time frame would help us be able to see that just a little bit more clearly and be able to interject where we think that difference may have been impacted by more than just the provider level. So, but by our current situation as well. So.
JJ, if you collect information on the amount of time spent on the calls, I would be interested in not only the number of calls that come in, but the time frame or minutes that are spent per day and call on the hotline.
You collect that?
I have to go look. I think we do, but there's some.
Would you be willing or able to be at our next board meeting? I think this is going to be an ongoing discussion.
Say that again.
Would you be willing I would like to invite you to our next board meeting because I believe this is going to be an ongoing discussion.
Yeah, I agree. I appreciate the discussion, appreciate being here today, and we certainly want to continue the discussion. So unless there's anything else, I'll just say thank you for your support. Thank you for taking the action today. And I also want to say thank you for, what was it, the 28,000 that the board allotted us, and then also the money that was allotted to PFCS. That was, we're very thankful for that during these times. So thank you.
You're welcome.
So if there's nothing else, we're going to sign off and leave you to your business.
Thank you.
Thanks, JJ.
Okay,
Thanks,
thank you.
JJ.
Okay, thanks, guys. I appreciate it.
Okay, there's one more item on the budget committee agenda. The year, the
Yep.
2019
Yeah.
audit.
Yeah, so everybody probably got an email about that, if that's what this is referring to. So the calendar year 2019 audit, I know there's a conference call yesterday about it. So Michelle going to take this, or Natalie?
You know, I'll say something brief, and if Michelle wants to add, she's welcome to add. We did have our initial phone call. Michelle has been sharing information and communication with them for weeks. I just wanted to let the board know that the state did begin their calendar year 19 audit.
Calendar year.
Michelle, anything else?
They did say on the call yesterday that the individual performing the audit is part-time, and typically there's more than one person working on the audit, so it may take a little bit longer to get the audit completed. But unless she can get some help, if she can get some help, then she'll be able to do it sooner. But just it probably won't be before the end of the fiscal year for sure.
Yeah, I thought she mentioned a July date. The other nice, or I think good thing, is they mentioned that this audit shouldn't cost us any more than last year's audit.
Right.
Even though there are some increases in the auditing fees that are apparently going around.
All right, well, if there's nothing else on that, then Julie, that's all for the budget committee.
Okay, thanks, Jeff. Moving on then to the Public Relations Committee, Brian Kress, can you share with us your meeting update?
Sure. The PR committee met back on April 21st, primarily to discuss the upcoming levy. And, we talked a little bit about, the overall workings of the PR committee and what all this group can be involved in through the year and so on. But our meeting really focused on the levy. So just a couple highlights from that meeting, really. One of the things we talked about was, do we reach out beyond the committee for further assistance throughout this process? We felt at this time that there's enough experience with board staff going through this many times, and some board members as well, that we will at this time keep to the PR committee and the staff. So we won't reach out beyond that, but we're going to leave ourselves certainly open to that ability if and when we see the need to reach out further for additional help. We will be looking at reaching to the agencies just to have a contact person sort of named and ready, that if we involve the service agencies, that we would have a contact person already established and could move much quicker at that point when we felt the need. Discussed, actually it was a recommendation through Mark that we discussed the importance of keeping our message simple to the public, and then just re-emphasizing it over and over to sort of pound that message in to the hearts and souls of those that are getting that. And some suggestions were thrown out there of no new taxes, no increase, things of that nature, and keeping our organization strong. And And a big part was as well as normalizing the mental health side of it. So, and I know, you know, as the agency, we've started to do that already. You know, there were signs at the square in Philly and some other places as well of on that same thought process, which I think is very good. And talking about continuing that, we as well talked about reaching a greater audience through podcasts, which hopefully everyone has seen some of those out there already. With Percy and others, very good. I know the ones I saw, I think I'm caught up and have seen a couple there that very good. And we'd like to stay with that. We also discussed Jen's discussion of paid social media to get much greater viewership on those as well. So I think that's being investigated and what route we can take there as well. Another suggestion was looking at how we promote the language on the ballot. Now, yes, we've submitted and they've agreed upon the ballot language, but we wanted to look into the fact that those that know us, some know us from just the ADAMHS acronym, and others know us maybe from the full alcohol mental health side of it. So, you know, we wanted to look at linking that together. So I think the ADAMHS name or acronym is a little bit more recognizable than the entire list of what we are. And so we want to look at potentially changing the ballot language to include both on there. So just it would be a greater connection, especially if you see us on those signs that are out there and will be out there in the future. When you're driving by something, it's much easier in that 5 seconds that you're looking at that sign, right, to see the ADAMHS name than read the entire length of what we are. So I think that's being looked into as well. And then we already have some billboards on the messaging side. We have some billboards already reserved for the fall. So that's ready to go. It's just a matter of when we complete our messaging and timing to getting those out in the fall, closer to election time. And then lastly, was looking at compiling a list of potential community champions. So those that may speak on our behalf, those that may go out to certain social agencies and things of that nature that might speak for us and be a recognizable name and spokesperson for the levy as well. So we're going to start identifying some names like that as well to bring to the table and look at having a greater force of recognition through the community and those that would be recognized throughout, and have them speak somewhat on our behalf. In addition to us, we'll all be doing our part as well, I'm sure, but that's maybe some more clout that we can bring to the table as well. So those were the general highlights. We're going to continue to meet, obviously, as the committee and with the board staff. Very grateful that the staff has gone through this many times before. They know what they're doing. They've got many past elections to benchmark from, and they've done a tremendous job on those in the past. And so kudos to them. And we're going to certainly lean on them a bit as well. And I think between the committee and the staff, we ought to be able to move forward pretty easily and start, working toward November. That's all I have, Julie, unless there's questions.
I have a question.
Sure.
Heather, I know I'm always bringing this up, but I'm just curious. I know having had levy experience with my husband in the DD world and things like that, sometimes you can get data, in terms of like where levies fail, where levies pass, things of that nature. I'm just curious if the barriers are any different that you come up against in terms of communicating the message. I know there's less outlets, in terms of opportunities for exposure with billboards, and they kind of span on the outside corners of the county and not as much saturated internally and things like that. So just curious to know if you have any specific barriers that are to Carroll County, particularly getting the message out there in any way we could help do that.
And I think, That's a great question, Heather. We did discuss some data on that of what townships and precincts, rather, we broke it down, or the staff did, and I thank them for that. They broke it down by precinct and where we do well, where we've not done well over the last two campaigns that we've had. So we've good history there, because one was a renewal and one was a replacement. We talked about where we've, where we put our efforts, right? Do we go into the areas we've done well and we have strength there, and we keep that population and make sure that they're voting for us because traditionally they have, versus going to the areas that are, have voted low for us, or so a lot of that data was discussed. I don't think in this case, this does not include, we're not going on the Carroll County election. So there's a little bit of separation there. Beyond that, I don't know that we broke down any further real barriers. Mike, you had some of the data there. Is there anything that you can add to that?
Well, I think that, as we've had for many years, one of our biggest issues is just name recognition of who the ADAMHS board is and what we do. That's why I think it's really important that we continue to do the stuff that we've been doing, just getting our logo out, our name out there, explaining to folks, how we're involved in the system and what our part is. What we don't want is for folks to only hear about us when we're asking for money. We need to make sure that people know, what we do at all times, so that then when it comes up to levy time, they can think back, oh, I remember seeing that logo. I remember hearing about them on the radio. I saw that billboard, whatever it is. That we are a little different than the DD system in that folks just don't really, I think, understand what the ADAMHS board does for the folks versus what CMH does or what person in the counseling does. There's a little bit of a disconnect there. So that's where our efforts, I think, in terms of messaging, have sort of got to go when it comes to levy time.
Right.
I would agree. Even anytime you're a funding source, for not direct service, it's always difficult for people to draw the lines and connect the dots. And I think that's why I mentioned the DD service, because it's kind of moving more in that, they've moved more in that direction and over the last couple of years. And I know it's created some barriers and some challenges about communicating the message. People just don't understand that. So I think having those champions, in those provider service networks will be really helpful for that message. So good job.
And I think, Heather, even though my statement prior was, we're not reaching out beyond the PR committee and the staff right now for, further assistance with other agencies and groups and so on. If anybody has got suggestions, certainly we're welcome. We'll be welcoming any suggestions that you guys have, especially, if you've been through that before as well, that, there's benefit there. Please don't hesitate to throw some things out. If you've got some more thoughts, we're all ears.
Okay, thank you, Brian.
Welcome.
All right, nominating committee is up next, and that would be Mary and Audie.
Nominating committee met 12:45 today prior to the full board meeting. We're bringing a recommendation to the full board. As you know, Julie's our board chair. We're certainly going to miss her. She's done an exceptionally great job. She has served 2 terms and is ineligible to serve again. So Jeff, our vice chair, has agreed to step into that role, and we certainly appreciate that, Jeff. In addition, Melanie Beam has agreed to step into the role of vice chair, and we thank you, Melanie, for that. So we're bringing today a recommendation that Jeff Neidig step into the role of board chair with Melanie Beam as vice chair.
Okay, thank you, Marian. And that is a committee recommendation, so we will just need to vote as a full board on their recommendation. Are there any questions or comments for Mary Ann and her committee?
Yes, when does this go into effect? Is it like July 1? I'm not sure.
Correct, July 1st.
Okay, thank you.
All right, if there are no other questions, Danielle, will you do a roll call vote for us?
Sure, Melanie Beam,
Do I abstain again or do I?
Yeah, really, I was asking that.
You can vote.
Okay, well,
You vote for me and I'll vote for you. There you
that's
go.
what happened in the nominating committee, Jeff. So
Okay.
when I say yes, it's because there are two of us on this roll here. So
Okay, there we go.
all right. Heather Campbell,
Yes.
Jennifer Demuth,
Yes.
Brian Dunn,
Yes.
Kelly Engelhardt, Brian Kress,
Yes.
Mark Murphy,
Yes.
Jeff Knighty,
Yes.
Mary Ann Awney,
Yes.
Holly Peyton Miller,
Yes.
Paul Rossi,
Yes.
Maureen Stoneman.
Yes.
Okay, motion carried.
Thank you.
On a second, is that all for that?
Yes.
We also wanted to let you know, if you haven't already, that Eric Frederickson, this would have been his last board meeting, but he is moving away with his family to Florida. We welcome the best to him in the future, but this does bring a board vacancy. So I believe, Natalie, do you want to add to that?
Again, I'd like to thank Eric, at least among us, for his commitment to the community. His commitment to recovery is going to be a big loss. When Eric and I talked, he had some suggestions of additional individuals to fill his position. So I was hoping to touch base with him today, but we will connect later and move forward with filling that vacancy.
Thank you.
Thank you.
Okay. Thanks, Mary Ann.
Mary Ann, I'm sorry. This is Mark, everybody. Eric is leaving. He just started.
I know. He's done so much in a short time that he's been here, but they feel a calling to move south. You know, his wife, this is just a little of their background. His wife's from Brazil.
Yeah.
Not used to this climate. And I think she's hoping to reconnect with more of her ancestry further south. So I know that was a big part of their move. But yes, we are definitely going to miss him in this area as far as the recovery and all else that he's done.
Yeah. Thank you.
Before you close out, I just want to thank the nominating committee and the board for their vote of confidence. I will continue to do my best and learn and grow with this position. So thank you. Looking forward to 1st of July.
Thank you.
All right. Okay, thanks, Mary Ann. We now have our director's report from Natalie.
Thank you. Okay, in your packet on page 17 is our fiscal year 21 sliding fee scale. Just as a reminder, the individuals that are in the gray area are those that align with potential Medicaid eligibility. So we ask all of our providers, when someone has an income in that area, please try to get them Medicaid eligible because that saves board dollars. The guidelines come down from the federal government. We plug in our funding, our sliding fee numbers. So this is a pretty easy process that we go through hand in hand with federal guidelines. So we do need approval from the board, though, to pass this sliding fee scale onto our agencies and consumers for FY21.
Would someone like to make a motion to approve the non-Medicaid sliding fee scale as proposed on page 17?
I'll make that motion. This is Mary Ann.
Brian will second.
All right, thank you. If there are no questions, Danielle, will you call a roll call vote?
Sure, Melanie Beam,
yes.
Heather Campbell, you still here with us, Heather?
I think we lost her.
I think she disconnected, yes.
Okay. Let me get the time there. Jennifer Demuth?
Yes.
Brian Dunn?
Yes.
Brian Kraft?
Yes.
Mark Murphy?
Yes.
Jeff Neidig?
Yes.
Mary Ann Audie?
Yes.
Polly Peyton Miller?
Yes.
Paul Rossi?
Yes.
Maureen Stoneman?
Yes.
Okay, motion carried.
Okay, next up is the FEMA grant.
We were made aware, boards across the state and providers were made aware of a funding opportunity in light of COVID and the federal government. I applied for, on behalf of the ADAMHS board, about $69,000 for things related to COVID. And these, I threw the whole kitchen sink in there. These are mailers to every residence in Tuscan Carroll County with ADAMHS board information, COVID information, mental health warning signs, billboards. We could do Post-its on takeout pizza boxes with behavioral health information and the ADAMHS information. The goal of the grant was to do outreach to individuals who may be having a behavioral health need in response to the pandemic. Again, our ask was for $69,000. When the state presented this to us, they gave us no limits, apply for what you're interested in. Across the state of Ohio, boards requested $25 million. What we found was that we only have about 1.5 million available from FEMA. So two things are happening. We don't know whose requests have been cut. But obviously there's going to be significant cuts, and the state is telling us if it's not been included in this application, they're doing another one in June and it will be included in that. So anytime we're connected to grant applications, especially at the federal level, I'd like to let you know. Julie, are you okay with me moving on to the next
Yep,
item?
please do.
So I know we're running late. I'm trying to make this as quick as possible. Please stop me with questions. We received, I've been in communication with our health department a little bit, and they're really taking a beating in response to in response to the pandemic. It's gotten pretty negative and a little bit threatening, and they were looking for some outreach and support from our behavioral health system. That spurred us to pull together a meeting of local leaders to talk about what can we do to provide some recognition to especially our health departments, but really many in our system of care that are doing, you know, a good job of supporting our community in response to the pandemic. The reason I'm telling you this is because I would imagine within the next week and a half, I'm going to be sending a Google document out to all of our board members. This is being drafted with the Educational Service Center and Veronica. And the goal of it is, if you just would take a few minutes, there's a couple different population categories: health department, clinicians, medical staff. If you just would write a positive note, if there's anything specific you've come across that you would like to be noted, or even just general statements. And we're going to compile these and do two things: share them on social media, and then for some of the health departments, most likely New Philly and Tusk right now, we're going to do something specific for their offices or their agencies related to those positives. This came about because of the outreach from Tusk County Health Department. I talked to Kelly yesterday. They're not necessarily getting the same kind of reaction that Tusk County is getting, but I still don't think that that means that we don't look at doing something similar in Carroll County. We're moving quick on the Tusk process. Let us get this under our belts, and then we'll work with Veronica and the ESC to do a similar process in Carroll. And should I go on, Julie?
Yep, go on.
Veronica has completed 3 utilization reviews. She talked about CMH's last time. PFCS had their review recently. It went well. There were a few items they caught that are going to be reversed. And that's expected. That happens. She did ComQuest's And the noteworthy item here is that we have really worked hard over the past 24, 28 months to have agencies identify individuals that would appear to be Medicaid eligible and then get them eligible. ComQuest still had, I believe it was, let me look right here, 7 of their 12 files who it appeared individuals should be Medicaid eligible, but the board was billed. The letter to ComQuest indicates if they can show us that the individual had applied for Medicaid and was denied, or a reason the individual wasn't able to apply for Medicaid, we will forgive that. If they're not able to do that, we are asking for our first repayment or reversal as part of the utilization review process. And that would be a total of $2,433.16.
Natalie, this is Brian. Do you think there's re-education needed in those areas on when to bill us and when to not, or is this just a blip on a screen and it'll pass?
You know, ComQuest is so big sometimes, and I would say this to Keith, so I feel okay saying this. Sometimes I think that the messages may not trickle down to the staff. You know, I'm showing you that, well, you have the fee agreement. Yeah. You can see every time they pull this out to see where the person should fall. Individuals that fall in that shaded area should automatically prompt a Medicaid application. So we can continue to educate. I think that it's quicker to bill the ADAMHS board, honestly, than to go through the application process.
Yeah. Okay.
That had happened for years until we really made this push. So.
Okay, thanks.
Anything else from anyone?
No.
My last item is we are planning to reopen the ADAMHS office on June 1st. 2 things that are in the waiting room. One is we're waiting to get some thermometers to have both for staff and for public that might come in. I also want to make sure our policy and our procedures for reopening the office in response in the middle of the ongoing pandemic has been finalized. So those I'm sure will be done by June 1st, and we're going to plan to open with some different structure and responsiveness starting June 1st.
Great. Yay.
That is all I have, Julie.
Okay, is there any unfinished business that someone would like to bring to the board's attention? Having no one speaking up, we'll move on to new business. And those items are regarding some upcoming meetings. On June 3rd, the Mental Health and Addiction Services Committee will be meeting to review the proposals that have been received for fiscal year 21. And then there's a follow-up meeting on June 10th from 12 to 1 if it is needed for further discussion about those proposals. There is a budget committee meeting then on June 12th to review the recommendations from the Mental Health and Addiction Services Committee meeting regarding the proposals. So make sure those are on your calendar. And I know that Danielle was working on scheduling a Tri-P committee meeting.
You read my mind. I was just going to add that I do think it's going to happen June 2nd. Just based on the location and the short notice and everyone's schedule, even though, you know, we may be back in the office, not knowing what the policies and how they will read at that point, it is, I've had requests from members that that meeting be a remote meeting. So it looks like it'll be June 2nd at noon.
Well, and Julie, can I just add that we are still over the 10-person limit. So until otherwise discussed, I think we're going to keep most of our meetings, all of our meetings, remote meetings.
Okay, that makes sense. So the June meeting for the full board will continue to be via video conference.
Unless there's some different guidance from the governor.
Okay. Mike, were there any questions or comments from people who might have been viewing on the live stream?
I checked about 5 minutes ago. Let me double check here. No, I'm the only one currently watching.
Okay. Well, having none, if there's no other business, we just need a motion to adjourn.
I'll make that motion.
I'll make that a motion.
Okay, thank you, Mary Ann and Polly. Okay, that will conclude today's meeting. Thank you for your attendance and all of your input.
Thank you, everyone.
Thank you.
Hi, everyone. Thank you.